Okay, thank you so much for joining us for the session of the Connecticut Affordable Housing Conference. My name is Carlene Chamos, and I'm the Collective Impact and Equity Director at the Partnership for Strong Communities. And assisting me today is Don Branson, our IT administrator. This year, the CAHC is focused on thriving communities, and each session spotlights a unique approach to strengthening housing stabilities for households and communities across Connecticut. You can join the conversation at hashtag CAHC 2023 across social media. This session is entitled An Innovative Partnership to Prevent Evictions and Homelessness. And before I turn it over to Meredith and Nikki, we would like to take a moment to thank our leading sponsors, the Connecticut Housing Finance Authority, our visionary sponsors, the Connecticut Department of Housing and Wells Fargo, our champion sponsors, Bank of America, JD Amelia and Associate, MMT Bank, Webster Bank, and the Melville Charitable Trust. And our foundation sponsors, Federal Home Loan Bank of Boston, Crown Resnick, and Trinity Financial. These sponsors' deep support has allowed the conference to happen again this year. Last but not least, a big thank you to our featured investor, CSH, for your support of the CAHC. A few housekeeping items before we get started. This session is being recorded, and we will make all of the recordings available as soon as possible. Please remain on mute unless your speakers ask you to come off mute. If you have any technology issues, please select the chat icon in the Zoom control panel and send it in the chat to Don or myself, and we will do our best to assist you. Your speakers will let you know how they would like content questions to be submitted, and then post-session, you can complete the feedback survey by clicking on the megaphone icon in the lobby. We truly appreciate your feedback. And with that, I'm going to pass it off to Meredith.
Okay. Good afternoon, everyone. My name is Meredith D'Amboise. I'm the Chief Quality and Compliance Officer at New Reach, and we provide housing and homeless services in Greater New Haven and Fairfield County. And I'll let Nikki introduce herself.
Hi, everyone. Nice to see you all. I'm Nikki Barnofsky, and I'm the Chief Program Officer for New Reach, overseeing all of our direct program services and management team. So excited to be joining everyone today.
Okay. So I'm going to share my screen. We're going to ask if folks have questions to put them in the Q&A box, and then we can go through them at the end. So I'm be looking at my other screen, so if I'm not looking right at the camera, that's why. So again, this presentation is on our innovative partnership to prevent evictions and homelessness. We're bringing together housing, landlords, legal services, and social work to stabilize households. So a little bit about New Reach. So we've been around since 1990, and we grew from a one shelter organization into an organization that really leads programs on the spectrum of housing and homelessness, starting with prevention, which is what we're going to talk about today. Again, we provide services in Greater New Haven and Fairfield County, specifically around Bridgeport and Danbury. And last year we served just over 5,500 adults and children through our programs. Wanted to bring up DEI. This is an important piece of our work that we've been doing. We know homelessness disparately impacts people of color, so we always have that mindset in the work that we're doing and make sure we're focused on challenging some of the inequities that exist. We have a very active DEI committee at New Reach. We've been around, I think, for about 5-6 years doing that work. So it's an important piece, and we'll talk a little bit more about that later on. These are our puzzle pieces. We really categorize our programs into prevention, crisis in housing and really feel strongly that it takes work in all three areas to really end homelessness. So our programs kind of fit nicely into these categories. So I'm going to hand it over to Nikki to talk a little bit more about our programs.
Yeah, so the categories that we're talking about really fit nicely as we all look at what the definition is to end homelessness. The first being prevention, which is we're making homelessness rare through our services of the Stable Families program and homeless prevention programs that we have in-house. Stable Families is the primary program we'll be speaking about today that we've been providing for a little over 14 years at this point in time since the inception of those services. Additionally, New Reach oversees family diversion staff in the Greater New Haven CAN, along with the partnership with Department of Housing for the homeless prevention program statewide. We're one of the last providers implementing those services until that program ends December 31st of this year. Next. When we speak of crisis services, we're speaking of emergency shelter services for 2 shelters that we oversee locally. Additionally, we have an innovative partnership currently called the Integrated Care Program, where we provide joint services with Yale New Haven Health in partnership of supporting women that are coming into the emergency and psychiatric units at the hospital that are homeless and need support services to stabilize housing and utilize appropriate medical resources. And as of recently, this past year, we recently merged with FISH, which is an inbound food service program for those that might have additional needs that prevent them from leaving the home and accessing regular food banks and supports. And thirdly, New Reach provides housing services, which makes homelessness non-reoccurring and one-time. These range from rapid rehousing to supportive housing for families, individuals, and youth, as well as affordable housing units that we have also developed through our programming.
There we go. And just wanted to provide a little bit of data on evictions. As we know, the pandemic put a halt to many evictions across the country and across the state for a good period of time, but just wanted to give some examples. Again, we're going to be talking about our Stable Families program today, which operates in the Bridgeport area. So in 2019, in the city of Bridgeport, there were 2,000 evictions. That dropped drastically the next year down to 627 as the moratoria were in place. And then looking at the full year of 2022, we are higher than the pre-pandemic levels of evictions. So it has certainly become a crisis. I know in the homeless world, we've been, kind of been waiting anxiously to see what the lifting of the eviction moratorium would do. And the rates have certainly skyrocketed. Okay, so just wanted to, talk a little bit about what the need is. Obviously, we know that the effects of evictions are long-reaching, but we find that the landlords really are in need of services, right? They're looking for those in the housing and prevention areas to provide some support because a lot of it falls beyond what their role as landlords can do. We have a lot of people that have several reasons why they may become at risk or experiencing eviction and really needing some support with that. And families don't always know, right? They don't always know who to go to for support. Specifically, in working with the homeless service system, a lot of the help you can't get until you're either homeless or at the very brink. So our program really tries to go as upstream as possible. So the impacts of evictions on the community. There's, a lot of research around this. So we know that people who are evicted are much more likely to become homeless in a 2-year period. We took a look at our shelter data. Again, we operate 2 shelters, and just about a quarter of people in our shelters coming in the last 5 years stated that eviction was one of the reasons for their homelessness. Those who are evicted have an increased need for legal services. They have higher utilization rates for medical and behavioral health issues, and they're more likely to become involved in the criminal justice system. For families with children, it sets them behind in their education trajectory. And again, kind of bringing up the DEI issues, people with who are evicted are more likely to be persons of color, and that's specifically Black women with children are the highest risk. So there's short and long-term costs. We've been, looking at the research and trying to nail down what those costs are. There's costs to the shelter system, the increased costs to the medical. So there's a lot of societal costs as well. So looking at our program, our Stable Families program, we have about 69% of our participants are under the federal poverty level, and just giving an idea as to kind of what the needs are for people who are going through evictions. This was a study done in New Haven, but just about 40% of the people who were in court for eviction had anxiety, almost the same amount had PTSD, and almost 20% had a history of suicidal ideation. So these are some significant needs. And 44% had a history of homelessness. We know there's, the biggest risk for becoming homeless is experiencing homelessness as a child. So really looking to put a stop to some of these. So we found this quote from the Corporation for Supportive Housing for maintaining housing for families is to find the key partners that bring negotiation, mediation, expertise, financial resources, education, and support services to address the root causes and impact of evictions across the community. Partners are typically drawn from legal advocates, government agency, housing advocates, property owner and tenant associations, and judicial system representatives. So we'll talk a little bit about how the work that we're doing fits into that best practice model. So we like to use this stool as kind of a pictogram for how we see our Stable Families program. To provide that stability to the household, we really see an important partnership need between the landlords. We work a lot with the Bridgeport Housing Authority in our work down in Bridgeport, social work, which is where New Reach steps in, as well as legal system. So really providing those three within this partnership can really provide some additional stability to the household. So data, I love to talk about data. So before we get into kind of the nuts and bolts of what the program is, just wanted folks to understand who our clientele are. So this is our most recent fiscal year. Again, follows in line with DEI. We've got about 70% of our clients that we're working with are Black, another 26% Hispanic. So again, these are focused mostly on the marginalized communities. Our households, we work with a lot of households with children, the majority being single households, single parent households with children, and also 2 adults in the house with children. And then we do work with about 40% of folks who are just adult only households. We've got a nice kind of spread on the age ranges, with the most being in the 25 to 44 categories. We have been focusing a little bit more because of some of our funding on the elderly population of 65 and older. So really seeing an increased need for that actually across all of our programs. And our needs. So we collect a lot of data. We take a look at what somebody's risk for eviction is. We created an acuity scale, and I think Nikki's going to talk a little bit more about that, that we use to kind of triage people when they come in. This was the first year, this past year, that we've seen everyone fall into either high or moderate. We have nobody who entered the program at a low risk. So these folks are really, we're getting the toughest people out there who present with the most challenges. Almost half are struggling with mental health. Another quarter have unmet physical needs or chronic health conditions. We do have a lot of domestic violence going on in the homes, and many were impacted by COVID, mostly through losing employment. So as you can see in this graph on the bottom right, looking at people when they come to us, where they are in the eviction process. Again, we're working really to get as upstream as possible, so we're not waiting until the final moment before they're evicted to get started. And I think that's one of the great things about our program is because it's privately funded, we're not as restricted in terms of when we can start getting involved with a household. All right, I'm going to pass it off to Nikki to talk a little bit more about the details of how the program operates.
Thanks, Meredith. So again, program implementation of services has been occurring just a little over 14 years since we launched this program in the fall of 2009. And so this program is an iteration that was developed after funding that was obtained for a resident advisory fund from what they call the Father Panic lawsuit that occurred previously for some properties that were torn down. And so with the funding that they obtained through this lawsuit, they were able to create a fund that, again, the residents are looking to support into the areas that they believe have the most impact within their community. So as Meredith was initially speaking for the assessment into the program, we did create an assessment tool that really gauges where a household is when they're coming to us. We've categorized it into 3 different areas, the highest acuity being for crisis services. Again, we get clients that at times are a day away from an eviction with a court martial ready to come out to their property, where we have been successful of intervening and supporting that household of just needing basic needs, supports, child neglect, safety needs, chronic illness. Again, a lot of our residents are living in communities where community violence and other aspects that are really impacting the household are occurring on a regular basis. Once we're able to resolve the crisis that's occurring when somebody is coming into our program, we focus more so on the linkage supports at that time of what those behavioral health needs are for the entire household. When a household is getting evicted, it's impacting all people present in the home, especially the children specifically, where we find a lot of support is needed to help the parents navigate what those needs are for the children. So again, we are only a temporary solution to supporting what is going on within the entire home. So really following a critical time intervention approach of making those linkages within their immediate community that they can access beyond our program supports. To lastly, looking at, again, what we all want to see is the sustainability of the household, really beyond program services. This is, again, making agreements to make payments with landlords, creating tenant education, supporting mediation, as well as starting to make those repayments, accessing, again, support of utility assistance and other avenues, so that if an emergency comes up again, that they will have somebody else that they can go to on kind of their safety plan to resolve and work through what that occurrence is. We do have clients that have circled back to come back into program services because it's that easy of really a no wrong door approach. It does not happen frequently, but it's really nice that there is a dynamic of support that the staff within the Stable Families program has built upon for just referral basis of managing kind of those day-to-day things that might come up, or just, again, somebody to lend a conversation to talk through what that person is going through. So I kind of want to spend a little bit more time, Meredith, if you go to the next slide, to kind of talk about, we've all heard of eviction prevention. And what does that really mean to us? And so I really wanted to spend a little bit more time of really focusing on the foundation of Stable Families. The first, which we've mentioned a couple different times, is the no wrong door approach. Many of times our systems don't allow us to go so far upstream of supporting a household. So waiting until a court process occurs could be very detrimental to a household who is very much actively seeking supports and assistance to prevent that eviction from occurring. A lot of times we will get referrals from property managers, landlords, and significantly from the clients themselves, who's referring neighbors or other people, just speaking to their own experience of what they've gone through and seeking support from the Stable Families program. That's been really a successful approach for us throughout this to, again, not limiting once somebody has gone through the court process to see somebody that is getting that execution come to the table, that we have worked to resolve pretty significant cases in a very timely manner. The other aspect of our eviction prevention program I like to hone in on is that Stable Families is not a rent bank. Our primary focus when it comes to services is around partnership and collaboration to support the household through social work services to resolve what was occurring within that home in order to obtain the amount of arrearage or issues with maintaining compliance within their lease agreement with their landlord. At times, we've been successful of gaining some financial assistance and really focusing on accessing community resources like the Unite CT or other eviction prevention funds that do come online. At times, we do obtain those internally so that we have some resources that we can access pretty immediately and those rare cases that we need funding in hand for that day. But a lot of the times when we're providing these support services, financial assistance isn't actually needed. A lot of times the landlords and legal counsel are coming and working together, just looking for a tenant to be able to make some type of progress towards payment or support. And again, sometimes we have some pretty significant arrearage cases where a landlord needs to see some type of money in hand sooner than not. So again, I really like to elevate this piece of eviction prevention as not just a financial assistance program and really needs to focus on the elements of supporting the household needs of what got them there in order to prevent that from reoccurring again in the future. The third aspect is just around trauma-informed care. We speak a lot about trauma-informed care for our clients. One element we don't speak a lot about is trauma-informed care for our landlords. Again, within this collaboration, it's a partnership. Landlords are not the bad guys when it comes to seeking these support services. I think in all iterations of work that we do, of course, there's always going to be challenges of those that might not provide the best partnership or support to the clients that we're working with. But we know through, again, the economy and systematic issues that landlords have been traumatized. Landlords, again, are seeking support as well when it comes to being able to manage their economic positions and support that they're seeking there. And so more so than not, as we work to provide mediation, and a lot of times support clients or tenants in really being able to not be afraid to have conversations and speak to their landlord and vice versa. And it's always surprising to see that, especially as we're seeing landlords that are coming from out of states and different areas, people are not feeling as empowered to reach out and make those relationships. So having somebody there to help support that avenue has been very successful for us. Again, another aspect of the work that we're doing is really enhancing the legal effectiveness through social work. If you're familiar with the housing court process, there's a lot of barriers that can occur once somebody is brought into housing court, especially on the legal side for how much an attorney can seek out additional information or documentation from a household for the case. Having the social workers and caseworkers that are supporting these cases helps to pull together different aspects of the case. It also makes for a really savvy team that have been really well-versed in legal supports and professional development training, that the further upstream that we go, and a social worker that is versed in legal can really alleviate some of the burden that is going to get pushed forward through the court process if we can support some aspects of those cases earlier on. It then allows the legal team in order to take on more cases. So we do this a lot of times through case conferencing with our attorneys on a weekly basis. They're very accessible to us through Connecticut Legal Services down in Bridgeport to answer questions as they come up or arise. We schedule professional development trainings amongst the legal team and our staff, again, to keep up on current law and findings through these cases specifically. And so, again, that aspect of really thinking about how we can utilize and enhance our case management services through that knowledge has been a really effective approach through this programming. And lastly, again, it's just really focusing about improving relationships between tenants and landlords, making sure that there are relationships that are happening there. And we know as clients are going through crisis, that's not going to be the easiest thing to develop over the course of time, or feeling like things are just too late for where things stand currently within their court process. So again, we're here to help to navigate those aspects through social work and case management. Another piece that we have been able to successfully build into the program model since the pandemic began is some peer support services. We have one peer support staff currently that's funded through some COVID funding that we received from the city of Bridgeport. So having somebody that has had that lived experience and supporting the clients has been another really wonderful engagement tool to supporting the needs of what our clients are seeking on a day-to-day basis, and further building just a support system from them. We'll go to the next slide. So if you're very interested, we have a very intensive training curriculum that we provide our staff in doing this work. Again, focusing on a critical time intervention model that some of you might be familiar with through supportive housing or rapid rehousing services, all the way down to eviction laws, fair housing laws, and elder laws. All these trainings have been really critical and really ensuring that we're providing annual support to these on a regular basis to staff so that they have the correct tools in their toolbox as they're constantly working with households that are in immediate crisis. And just circling back a little bit further onto the funding of this program, what really creates the innovation of the Stable Families program is that it is privately funded. As I spoke of earlier, these funds initially came through a lawsuit that began in 1987 and settled in 1993. And so those funds have been the primary source of us starting the kickoff of these program services. But New Reach has been able to work through other private dollars and foundations, as well as looking into further resources from our local governments to see how we can further enhance and support the increase in need of capacity, because we know that the need is there. The capacity for us to provide the services, although is limited without the resources to do this level of work. So again, just to list a little bit further through some of our partners, I believe some of them might even be in the room today for this presentation. Again, Stable Families is not a work of just one program. It really is a collaboration and partnership through many different providers of connecting those elements of support throughout the community and really looking to stabilize. So I just really want to say thank you to Park City Communities and Connecticut Legal Services, who really have been at the forefront of these services and innovation and working with us. But again, we can't do it without our partners at Opening Doors, as well as Unite CT, PT Partners, and the Connecticut Association for Human Services.
All right, I'm going to talk a little bit about our program outcomes. So on the right, at the bottom right, is our success rate in preventing evictions. And that really measures at the time of the client's discharge from our services, whether or not their eviction was stopped. So we had, we've been wildly successful. This is the past 5 years. Over the course of the 14-year program, we have a 98% success rate in preventing evictions. As you can see, this past year, it dipped down to 94. Again, with all of the evictions going on that were restarted, probably wasn't a big surprise. On the top right, we were able to track for that year the amount that this was specific to the Bridgeport Housing Authority that the tenants owed to the Housing Authority when they came to the program and then when they left. And from intake to discharge, among that year, tenants owed $180,000 less after their participation in the program. And just to put into some context, I believe we had about $15,000 or $16,000 worth of rental assistance funds during that time period. So the difference in that was, negotiated agreements, accessing other services, or getting rents adjusted. So, for a long time we heard, we've been talking about our success rate, and we got a lot of questions back saying, okay, that's great, they prevented the eviction. So what happens to the households after that? So what we wanted to do is to be able to have some sort of long-term measure on the success rate of these tenants. So we're able to work with the Connecticut Coalition to End Homelessness and do a data match for a 10-year time period from our Stable Families participants from 2011 to 2021, and to look to see how many had entered the homeless service system since their participation. So again, it was a 10-year look back, or up to a 10-year look forward for those who were in the earlier years. So the pie graph shows that we had only 1% of clients that were ever in our Stable Families program had entered shelter. So this was, our sample size here was about, I think, 550 households, give or take. I'm sorry, no, about 450. So only 3 had ever entered shelter since their participation in the program. And there was another 4% who had an appointment, kind of showed up at the front door of the homeless service system, but never entered shelter or unsheltered homelessness. So this gives us an idea that there is, kind of more long-term housing sustainability, even after services end. So talked a little bit earlier about the impact of evictions on the community. And so mentioning that there's a lot of short and long-term costs. There've been a lot of studies that have looked at how many people who were evicted become homeless. So there's about a 25% estimation on that. And so using data from this study on a national level, if we were to prevent evictions, it could save the country between 61 billion and 128 billion. So there's certainly a lot of reasons why we want to prevent evictions from happening whenever possible. It's a traumatic experience for the household to have to go through. Certainly it can be costly for the landlords as well. And there's just a lot of societal impacts. So we wanted to share a video that highlights one of the clients that we worked with last year and her participation in the program. And this was put together by one of our private funders. So I'm gonna hit the button on here.
My name is Brenda Butler. I was a manager at Dunkin' Donuts in April 2021. I got an emergency phone call from my husband stating that he was in St. Vincent Hospital and that he had COVID. My husband stayed in the hospital. He took a little turn for the worse. His organs started to fail. He had to get put on life support. And that time we were just holding on, praying and hoping. Eventually we had to take him off of the life support. After that, we were going through the motions of having his funeral. In that time, I had gotten an eviction notice under my door. We were in debt over $10,000, and I was not aware of that. I was working, giving my husband the money. His name was in everything, so he was taking care of everything. I trusted my husband to do what was supposed to be done. I mean, are you not supposed to trust your husband? I mean, that's what married couples do. And didn't know what to do because I've never gone through that process before. And then a little bit down, that made things even worse. My daughter was sexually assaulted. And I basically just was not in my right state of mind. I'm hurt, I'm sad, I'm mad, I'm confused. I wanted to give up. I wanted to jump off of a building at that moment in time because it just was, is this really happening to me? Am I really going through this stuff? I had got in contact with somebody from the church, and they let me know that there was somebody that they knew, a program called New Reach, and they let me know that they wanted to help me, and they embraced me and they helped me. And I thank God for them because they were there for me mentally, physically, and emotionally. New Reach is great. They are absolutely awesome. They helped me pay off $15,000 of my debt. They helped me to find other programs that would be able to help me. Right now, I'm working 2 jobs, and I see a tunnel there, and I see the light down there. It's very, very far, but I see it, so I know that it's there. So I know that I'm on a path to success. I may not be there exactly yet, but I'm on my way. And it just felt good that to have someone have my back and to talk for me when I couldn't talk for myself. And it felt good to be able to have somebody to do that for me. And I just thank God that He put them in place in my life to be able to help me. And I'm just very grateful for that, because who's to say where I would be right now?
Okay, so that's just one of our client stories from last year, and you know, they all come with different stories that have brought them to our doors. So as Nikki mentioned, just want to reiterate, like, we really try to help people as upstream as possible. No wrong door, so people can be self-referred, referred by partners in the community, by the landlords themselves, friends, family, and it really allows us to work as preventatively as possible to save some of the trauma of eviction and homelessness. So that's the end of our formal presentation. So I think we can open it up to questions. Questions, comments. Well, we have a couple longer questions that may take a little bit more time to go through. Ellen has a question. Would you expand on the kinds of work you do with landlords? And I'll let Nikki take that one.
I guess I don't know if there's any more extent to the type of work that you would be looking for us to extend out. But again, when it comes to the type of landlords that we're working with, because I'm going through the chat here too with some other questions, hopefully I can help to fill in the gaps as we go through these. Again, right now through Stable Families, we do work with Park City communities, so public housing authorities, as well as private landlords. So that demographic for landlords can shift quite a bit depending on what geography you are providing these support services in specifically. So I think we're always open to what partnerships look like with landlords, again, and meeting what those immediate needs are when it comes to eviction prevention services. Again, we've had landlords provide resources. We tend to work with landlords a lot of times to save units if somebody does want to relocate at times to prevent an eviction, to help support them with filling units and support. So again, many of our landlords are just looking to find some supports to feel like we're moving the needle a bit when it comes to where the eviction lands, when it comes to whether it being a safety issue and feeling like those needs are being addressed, to, again, even a partial payment, which a lot of the households that we're serving, we do provide partial payment assistance for a stipulated agreement specifically. So I don't know if you have any other thoughts or ideas of where you think that the relationship can extend out, but we are always open to those kinds of conversations for further collaboration and innovation.
All right, there's a question here from Brooke, mentioned at the beginning of the presentation that 26% of the folks in our shelters identify evictions as a contributing factor to their homelessness. So just asking what the other percentage is made up of. It really is a whole host of other things, and these are kind of categories in our client database. So I think the most prevalent one is their expenses exceed their income. So some of it is also related to breakups in relationships. We do have domestic violence as well, family moves. So there's a whole host of other reasons that could contribute as well. Another question, although you have clients that are in distress, will you consider providing or working with an agency or agencies that can provide rental education, giving them the tools to help themselves? And I'll let Nikki add on to that, but you know, we're always looking on who we can partner with for this. So, you know, any kind of resources we can give to folks that will help them in their long-term sustainability is fantastic. I don't know, Nikki, if you have anything to add on to that.
Yeah, definitely. I mean, I think there's not a one approach that fits all. And so a lot of times our clients could be interested in collaborating with other organizations. We don't want to make this program services that all live under the Stable Families. Again, it is about partnerships and collaboration. So we've definitely made a lot of different connections into the community around rental education, fiscal. I know we do a lot with Connecticut Money School to support, again, just different avenues of support for that individual household's needs.
Let's see. How does New Reach pay for all these great services? So that's a great question. So it started off with funding from the lawsuit that we mentioned earlier. So the Bridgeport Housing Authority was required for that lawsuit to set aside dollars for resident services. And through the years and working with the tenants and with our partners, this is the model that we came up with that could kind of give folks the biggest bang for their buck. And that funding is tied to families with children in the household. But since then, we've really been able to expand on some of our funding and looking at it, a lot of it is just private family foundations. We have some donors as well. And we do have some of HUD ESG funding that funnels through the city of Bridgeport, and that we can only use to work with a subset of our clients based on the requirements from HUD.
Yeah, I will say a challenge that we do have sometimes when it comes to obtaining further resources for this is many of our projects, especially if you're providing services through the Coordinated Access Network, federally don't fall under the guidelines for expending beyond the front door of the system. So really, again, another model when we talk about homeless prevention is the diversion services. And so again, as we go further upstream, as much as we know the big impact that attending to these needs sooner before somebody is hitting the front door of the shelter system is critical. It is just finding the right dollars to leverage along with these resources as we're having such significant and positive impact, and ones that are going to allow us to make decisions as the service provider and experts in providing these services that we can maneuver quickly. Again, knowing that a household might be an immediate court stipulated agreement that they have to follow and can't truly comply with, to having a court martial at their door. So flexibility for funding is really an important aspect of being able to do this work, showing that we're not creating too stringent parameters around clients being able to access the resources.
Another question here about a little bit more about the landlords that we work with. Because of the funding, initially, we were primarily working with the Housing Authority as a landlord, also working with those getting subsidized Section 8 units, so some of the private landlords in the community. But since we've been able to expand a little bit, I want to say about 60% of our tenants, it's the Bridgeport Housing Authority who is the landlord. But we do work with more and more private landlords each year. Another question, are there any partners located in other cities who could replicate your program, or other organizations who are running programs similar? You know, I know we've worked, because we're based in New Haven, we've had a lot of discussions with the New Haven Housing Authority, as well as New Haven Legal. And I think folks are on board, and it's always the question of who's going to pay for the services. I think we've got a lot of folks who are interested, and see the need for it and the benefit for it. But it's getting the funding at the table. That's been the challenge. So, you know, we do see it as something that we would like to replicate across other areas in the state at the very least. We're actually in the process of developing a database and hoping that we'll be able to expand out and replicate this across other areas, but looking for the funding for it. So definitely open to explore other partners and organizations who are interested in this work as well. Question, what other avenues are available for individuals facing eviction outside of the 211 system? Often a long wait for assistance, and 211 in most cases can't respond fast enough to prevent an eviction. I don't know, Nikki, if you want to take that question.
Yeah, I mean, again, I think with what we're looking for community resources, it's very limited. And we are really trying to see what the landscape is going to be looking for these services, as a lot of the COVID and ARPA dollars are now coming to an end specifically. As I noted, one of the other projects that we've been a part of that will also be coming to an end is the homeless prevention program, which was linked to the Unite CT dollars and providing case management services across the state. Due to our ability and length of time that we've been providing these services, we're one of the last contractors for this program. And so we would love to see another iteration come online. As we know, the need is growing as we're looking at our by name list numbers and wait list numbers coming into the shelter system. But I will always push to say right now, I think that 211 has the best grasp of what is available locally. And so that can be a little bit disheartening, I think, for a lot when you are trying to access support services that you recognize don't truly exist. And so I always push people to work with their natural supports and local supports, whether that is a child's school and looking for resources, to talking with their landlords, speaking kind of again to if they have a church community or other communities that they're a part of, to talk through again what areas of support, because we have found on a grassroots, in my background in doing grassroots work, that there's a lot of power in the community and supporting one another through what they know is available for needs, because typically they will find out faster than some of us will. So not the best answer, but I think, you know, we have concerns as we are trying to look to duplicate that. There is a significant need that we know that our shelter systems are not going to be able to take on as a result of this crisis.
Yeah, the rate of homelessness since the pandemic began has more than doubled for families with children. I think it's up about 35–40% for individuals. So there's just simply not enough room in the crisis system for everyone. So the further upstream we can get and better we can do at prevention, the better off we'll all be in the long term. I think we ran through all the questions in the chat and Q&A, but I know we have a couple more minutes. So if anybody wants to jump in with any last questions. All right.
Well, it doesn't look like there's any more questions coming in. I'd like to thank everyone for attending this session. We have about 8 minutes until the next session starts. So if you return to the lobby from the screen, you'll have time to get a cup of coffee before you join in on the next one. And thank you again, once, Nikki and Meredith, much appreciated.
Thanks.
Yeah.
Have a good afternoon, everyone.